And hi, this is Dr. Bill with just the tip of urology school. And we're going to talk about a particular form of a renal mass called oncocytomas. About 15% of adult tumors in the kidney, a 2-to-1 ratio of male to female. Grossly, it's well circumscribed and encapsulated, a mahogany brown color with a characteristic central scar. It's usually safe for surveillance. If you're comfortable with the diagnosis, there are some uh, particular specific radiographs that can be obtained to help secure that diagnosis. And this can be associated with a renal mass biopsy. So if you have those two in play and you're comfortable with oncocytomas, this is something that can be observed periodically. There are some associated genetic abnormalities, something called a Burt-Hobbe-Dube syndrome, which is a constellation of skin hematomas, pulmonary cysts, spontaneous pneumothorax, and it also has an increased risk of renal cancers. So it's not to be ignored. As always, look at your core curriculum and look at up-to-date apps. A lot of information on this. Dr. Bill, just the tip of urology school, looking at oncocytomas.